Representative Anthony Weiner with us on set, voted in favor of the bill on Saturday. Welcome back. Nice to see you. Dr. James Rohak in Houston, Texas is the president of the AMA, a cardiologist by practice. Doctor, welcome. I'm going to begin with you, Congressman. Why did you vote yes, and how do you get over some of the objections relating to cost or policy, whether it's the debates about sort of draw the line American issues like abortion, which are ultimately irreconcilable among 305 million people, but are forced to the fore when you deal with something like the public option?
Well, the abortion language was troubling because it didn't represent where the majority of American people are, and I would argue that, frankly, overwhelming majority of Democrats aren't there. Hopefully that's going to get fixed in the Senate. You know, the cost and the public option thing are not two issues, they're one and the same. If you have a strong public option, the whole bill winds up being less expensive. So hopefully some of the opponents in the Senate will realize if we want to control cost, we need more choice, and we need more competition the public option brings. But at the end of the day, we had to do three things, and I think we did them. One is we had to provide coverage for more Americans so you and I don't keep paying their bill when they go into emergency rooms. Two, we had to make sure that people had a health insurance, were treated well by their companies, and we have restrictions on that. And the third, we do have cost containment with the public option. So it wasn't perfect. You know, I wanted a single payer plan, but this is a great start. We're now in kind of our red zone offense trying to get this over the goal line.
Dr. Rohak, how will doctors respond to a version of the legislation that was passed? If what was passed this weekend was made into law, how would you respond to it as a physician, and how do you think most physicians would respond to the new rules?
Well, the AMA has been fighting for health system reform because we know the status quo is unacceptable, and if we don't do anything, health care is going to be unaffordable for more and more Americans every year. So we wanted to have the Congress attack this in a way that says, how can we make sure that at the end of the day, decisions are made between the patient and the physician, and a government bureaucrat or an insurance bureaucrat isn't going to be between us. How can we make sure that we expand health insurance coverage with more choice, and how can we make sure that we incent people to be more healthy? There's many components in that bill that will achieve those goals.
The language of choice, the language of possibility, the language of patients and doctors being closer together is powerful rhetoric. It gets applied a lot of different ways. Sarah Palin uses it her way. The Democrats will use it their way. The unions will use it their way. We can go on and on with it. At the end of the day, we all know, though, that the status quo is a monopoly or oligopoly insurance companies, right, with an employer-based system where most people don't get to choose. In other words, if I wanted to go to the Mayo Clinic plan because I thought it was a better plan for me, I don't have that liberty, although with anything else in our economy, I could go buy a BlackBerry instead of an iPhone or whatever it may be. Why do we find ourselves sort of dragged into a single payer or a public option debate over and over? Not that it's not, I'm not even saying it's not worth the time, but I feel like it sometimes distracts us from the fact that we are dealing with it that is enabling a monopoly provider and limited consumer choice. And there are multiple ways to solve that problem, and none of this legislation seems to do that.
Well, look, yes and no. First of all, the doctors have been a very constructive voice here because they talk about what a headache it is dealing with insurance companies every day. When people say, I like my coverage, they really mean they like their doctor. The fact of the matter is that it's not like a BlackBerry or an iPhone, is that if you want an insurance plan, you want one that covers doctors in your neighborhood.
Sure.
And most plans in Maine don't have coverage in Manhattan. So I'm open to ideas on trying to get insurance companies to compete, but they've basically shown, you know what, if they do compete, it's not going to be on price. They're not going to try to have better prices.
What about competing on better health care?
I'm not really sure they're doing that either, because right now so many people are basically given their health insurance plan by their employer because the employer negotiates for it.
But doesn't that mean we need to blow up the employer-based health care system?
You're arguing with the wrong guy. I believe that the employer-based system should be replaced by single payer. And it's funny to hear Republicans complain we're going to a single payer plan. I'd love that, and from your argument, frankly, you might as well, and many people have Medicare like a single payer plan. But this is a way to incrementally get more people covered, try to have them treated better by their insurance companies. But if the insurance companies are being honest and they want to compete over state lines, great. We'll govern you over state lines, and every other company, you won't have an antitrust exemption, which is one of the things we do in the bill.
As a physician, doctor, what system would you most want to interact with?
Well, we would like to ultimately have that decision, so if the patient and the physician want to privately contract for medical services, they'd have the ability to do that. Right now, we know it's not a perfect bill because it doesn't preserve that choice, both in government programs as well as private insurance programs. But I think we need to also emphasize the urgency of getting something done, because of January 1st, There is a rule of a flawed formula that's going to impact access for seniors and military families. A 21% cut that's going to make it very difficult for physicians to continue to provide care. The companion bill 3961 needs to be voted on by the House and needs to be taken up by the Senate because that's the most urgency that's going to impact access to care starting January 1st, and Congress started the problem. Congress has to fix it.
The rhetoric that this bill is dead, DOA in the Senate as it stands. Do you believe that? Can that be changed?
Well, if I start taking political advice from Lindsey Graham, we're not going to get anywhere. Look, he's not voting for this. Republicans say they're not voting for anything. It's hard to pass a bill. This thing is not DOA. In fact, this is further and closer to the goal line than I think we've been any time since the Medicare Act was passed. We have to all make some concessions, and I would say to my friends in the Senate, if you believe in a public option or not, let's have a vote on it. Let's see if 51 members, a majority of this country, that's all we're asking people like Senator Lieberman. Just don't hold us hostage on ideological grounds. Let's have a vote on it.
Understood. Congressman, thank you so much. We'll see you later. Dr. Rohak, a real pleasure. Thank you for the time and the conversation this morning.